Welcome to this brief clinical and microbiological overview of Acinetobacter baumannii, an increasingly significant pathogen in healthcare-associated infections. Acinetobacter baumannii is a gram-negative, non-motile, strictly aerobic coccobacillus. On non-selective media such as blood agar, it forms smooth, opaque, slightly mucoid colonies after 18 to 24 hours at 37 degrees Celsius. Colonies may appear grayish-white and are non-hemolytic. On McConkey agar, it produces lactose non-fermenting pale colonies, similar to other non-fermenters. Biochemically, it is oxidase negative, catalase positive, and non-glucose fermenting. It's indole negative and reduces nitrate variably. Standard identification can be enhanced with automated systems, but increasingly, moldy TOF mass spectrometry provides rapid and precise species-level identification using unique protein spectral fingerprints. Clinically, Acinetobacter baumannii is an opportunistic pathogen notorious for nosocomial infections. It primarily causes ventilator-associated pneumonia, catheter-associated bloodstream infections, wound and burn infections, and urinary tract infections. It also plays a role in post-surgical meningitis and osteomyelitis, particularly in trauma or ICU settings. Its clinical presentation depends on the infection site, but often includes signs of sepsis, pneumonia with purulent secretions, or fever of unknown origin in ventilated patients. Treatment is challenging due to multidrug resistance. Many strains are resistant to carbapenems, aminoglycosides, and fluoroquinolones. First-line therapies often involve high-dose sulbactam, polymyxins like colistin, and tigecycline or minocycline. Combination therapy is sometimes used to optimize efficacy against extensively drug-resistant strains. Resistance mechanisms include efflux pumps, such as the ADABC system beta-lactamases, including oxay-type carbapenemases like oxay-23 and oxay-58 outer membrane protein modifications and biofilm formation, which enhances environmental persistence and device colonization. Acinetobacter baumannii's ability to survive on dry surfaces and acquire resistance determinants makes it a formidable nosocomial threat, particularly in critical care settings. This video is intended for educational purposes only. It should not be used to guide clinical treatment without referring to current antimicrobial guidelines and peer-reviewed sources. Subscribe and explore more lectures within our playlists. Thanks for watching.